So, good morning. Today I'll be telling my views or the way to do cannulation with a medication, IV cannulation with a medication. So, presently I don't have all the devices to tell it. I will be trying to demonstrate it as much as I can with all possible, demonstrating it very properly according to me. So, in IV cannulation, there is a gravity drip device which is needed. That gravity drip device, in that there are certain tubes. First of all, we will have the medication like what if just we have a saline of glucose 0.9% of NaCl. We will hang that saline. We will see that saline's uh, expiry date and the amount of saline which the doctor has prescribed to that patient. Then we'll hung that saline on a stand which is present in the hospitals. Obviously, that saline is connected with a dripping tube. After attaching my dripping tube to the saline, I have to push the dripping tube so that amount of drops come into it. Then there is a tube connecting to the dripping tube, dripping canal, a small portion, a small white portion which is known as dripping canal. Below that dripping canal is a dripping tube. That dripping tube contains a roller. By rolling that, the amount of drops starts to come down into the dripping can. Then there are certain attaching side canals also to give one or two medications along with that saline which is coming from upwards. And that dripping tube finally connects to the cannula, which is through IV cannulation. So this is a whole gravity drip device. So how will I start, or how will I proceed this procedure? First of all, I need sanitizer. I don't have alcohol wipe, so I'll use cotton to wipe the hand of the patient. Then I'll see the prescription, the amount of medicine which has been prescribed by the doctor. Then I'll take that medication, hung it on the stand. Then I will pinch off the dripping tube and get the amount of drops which I want. And then I'll start the roller. No, I will not start the roller. I will first connect it to the IV cannula which has been settled up already into the patient's hand. And then I will attach the male pural into the dripping cannula, into the cannula, and then start the roller so that the drips come off. The dripping amount has been set by the doctor itself, that is 20 drops or 30 drops in 1 second, in 1 minute, or 50 drops in 1 minute, depending upon the severity of the disease. So this was all about how gravity drip device works. Since I don't have all the equipments with me, I hope I made myself clear.